tourism and health program is a system that monitors real-time health threats in Caribbean tourism accommodations to trigger early warnings to prevent and or minimize the spread and impact of disease. It is an early warning response and travel health system. It's web-based and it's real-time. So once the information is input into the system generates the syndrome and the output immediately. This is for early response and to stop the spread of disease, protect the reputation of facilities, and decrease economic damage to the country. All the data is confidential. No names and persons are targeted. The data is not published and it's not stored anywhere. It's not a system to track hotels, but what it is an internal health monitoring and alert system for your facility and for your country. So when information is inputted, the only person that sees this information would be the Ministry of Health to help assist your facility in responding to whatever issue that is being faced within the facility. What happens is the facility or accommodation reports a case of illness in real time, and then they're able to access data analytics for their specific facility. So you're not able to access information from any other facility in country or out of country. The only access that you have is for your facility. There's also another module where guests or staff can anonymously report illness from a facility. So for example, if you have gone to a hotel, you may have returned home and realized that you feel sick at home, you can then go into the system and report yourself. Or if you're in the country, you may not be staying at a facility that is registered as an accommodation, you can also report. So the Ministry of Health knows that something may be happening in country. Once this report is made, it goes into the web application, and the web application produces data analytics. If there is enough of an illness, the Ministry of Health will receive an alert to say that something is happening at a facility. The Ministry of Health will then review the facility level to investigate the alerts. They might call the hotel, call the facility, find out if they are aware and what is happening. And they can also review the national data to see if this is something that's happening across your country. What the role of CARPHA, which is our surveillance mandate generally for all surveillance data, we are able to see DI, total alerts reported from countries. So for example, if there's an alert in Hotel A, all CARPHA sees is that there's an alert in country, but not specifically to the hotel that the alert came from. And this is for a monitoring role. If there's an issue or a serious issue, CARPHA can then call the Ministry of Health to find out if they have also received the alert and if they need any help with the response to the issue. Once thresholds are reached, you hear me talking about alerts, the system generates the alerts automatically. So once the data is entered into the system, nothing else is needed from the end users. The system will generate the alerts and send them to the relevant persons. They will send them to the manager or the person who has been nominated to receive alerts for the specific facility, and also the one person who is nominated at the Ministry of Health to receive alerts for that facility. The system tracks a few syndromes. 6 syndromes that are all monitored by the WHO, the World Health Organization. Gastroenteritis, undifferentiated fever, fever and hemorrhagic symptoms, fever and neurologic symptoms, fever and respiratory symptoms, and fever and rash. Now, this is an early warning system. So the ill person does not necessarily have to be diagnosed. All you do is enter the person's symptoms, and the system will generate one of these 6 syndromes for you. Gastroenteritis, what mostly occurs in facilities, and this can be something like a norovirus, or food poisoning. Undifferentiated fever are diseases such as dengue, chikungunya. Fever and hemorrhagic symptoms can be severe dengue or Ebola. Fever and neurologic symptoms, fever and respiratory symptoms, things like influenza, fever and rash, things like measles. So there are different alerts for different syndromes. For example, undifferentiated fever, most countries have dengue endemic in their country. So once dengue is in your country, you know that a certain time of the year, dengue is going to be around. So the Ministry of Health will determine whether they are worried about a case of undifferentiated fever depending on what is happening nationally. Fever and hemorrhagic symptoms may be something that is more severe. So one case will generate an alert to both to the user and to the Ministry of Health. Also, fever and neurologic symptoms will generate an alert immediately to the user and to the Ministry of Health. Fever and respiratory symptoms is similar to undifferentiated fever, where countries may go through a flu season. You will see an increase in cases in fever and respiratory systems, so the Ministry of Health will determine the threshold for that. Fever and rash, which are things like measles, one case will generate an alert because that, again, is something that is very serious. The different types of users, I've kind of gone through this before. We have facility users, country users, and CARPHA. The facility users are twofold. They're the administrative staff or the hotel nurses who will be the ones reporting the data. Hotel management, or the nurses as well, depending on your facility. They're the ones who will have access to data analytics. So at the facility level, there are two things: the data entry clerks and the persons who are able to do data analytics. The data entry clerks are only able to enter data. They cannot access the analytic page. The only person that accesses the hotel's analytic page are the persons that the hotel decides can have that access. And that's usually somebody in management or the hotel nurse or the health and safety and environmental officer, etc. At the level of the Ministry of Health, there are epidemiologists or surveillance officers who deal with surveillance generally. And these are the persons who will have access at the country level. At the CARPHA level, the THP epidemiologist and the head of THP is only able to see the DID'd country information if an alert is sent. So for example, if there is an issue at hotel A, B, and C in country X, what CARPHA sees is that there is an alert of a certain syndrome in country X. They aren't able to see whether it has come from hotel A, B, or C. So what happens? The hotels or the facilities complete a registration form, and we'll go through the registration form at the end of this session. They then are provided usernames and passwords for the managers at the manager level and also the data entry clerks at the data entry level, and these will be two separate passwords which are generated by the system. Persons can then log into the web application and report cases. The managers can log in to review reports and export details of cases. And if there is an issue, automatic alerts would be sent to the facility managers to say that something is happening at your hotel. So the forms are filled out and submitted to CARPHA. The computer generates the registration. The login is sent to the manager, and once that is done, data entry can start. And the process usually takes 24 to 48 hours once the registration has been done. We have some resources available separate and apart from this video. There's a user manual for the system. There's an instruction flyer for the data entry persons. And there's an information pamphlet for visitors in accommodations. And all these would be provided to you along with a PowerPoint presentation which outlines the demonstration that I am going to do next. So what we do, the first thing in order to register is going to the web app. So you log in at this.carpha, that is CARPHA, this.carpha.org. When you log in, as we said before, there's the self-reporting module and there's the sign-in module. The self-reporting module can be accessed by anyone, and that self-reporting module is very similar to the module for the data entry clerks. So I will show you the data entry module. So we sign in, and we have come up with a country called Demonstration, and the hotel that we utilize in this country is called the Phoenix Resort. So the Phoenix Resort in Demonstration country has a manager, and they also have a data entry clerk. So I'm going to sign in first with the data entry clerk login so you can see the reporting form. The important thing to remember at this login page is to sign in the sign in as box. If you are a facility, you choose the facility tab. Once you sign in, you'll see this report case, and you see at the top the Phoenix Resort, because we use the Phoenix Resort login, is at the top. So there are pre-populated fields for the Phoenix Resort because you already have logged in as the Phoenix Resort. These pre-populated fields you cannot change. So there are some optional fields, but there are 4 required fields that you need in order to submit a report. And as we said, all reports are kept strictly confidential. There are no names. So the reporting form is very intuitive in that the data entry clerk just asks the questions to the guest or the staff member and clicks the answer that they give. So are you a guest? The person would say yes, they're a guest, or they're a member of staff. The country in which your facility is pre-populated because you've signed in at the Phoenix Resort. So Demonstration is already pre-populated for you and you can't change that. So you can't report from another country. The type of facility is also pre-populated, and the facility name is also pre-populated. So you cannot report from another facility. You can enter the person's age. And if you miss out a field, just like I did, you will see that it would not allow you to submit the report. So once you put in the age group is automatically generated. You can put in the person's gender, and then you have to choose the person's home country, which is something that is very important for surveillance. For example, if there's a disease outbreak in a country, the Ministry of Health might be able to track the illness easier if they know where the person has come from. So we can say that we have come from Belgium. What countries have we traveled to recently? And this is a drop-down box, and you can tick all the countries that have been traveled to recently, which is the same as the home country, because if there's a certain outbreak in a country in which you have traveled within the last 4 weeks, surveillance is able to track down the illness quicker. The date that you make the report is pre-populated depending on the day that you sign in. And then you can enter the date of the first symptoms. Now, if the person is unsure, you can ask them for an estimate. And that will help finding things like incubation period. So we'll know, for example, if the person came into the country yesterday and the symptoms started 2 days ago, it's not likely that the person picked up this illness in the country that they're in currently, but they may still be able to transmit it within that country. So this is very important as well. And also to protect the hotel, that you know that the person has gotten ill outside of the country and has now come into the country. And you can estimate. Question 10 is the most important question, in which you ask the person if they've had any of these symptoms. So you just go down the list and ask them. If they say no, you leave it alone. If they say yes, you just click. So have they had diarrhea, which is 3 or more loose or watery stools in the past 24 hours? Have they had nausea or vomiting? Have they had fever? Yes, they've had fever and they've had cough or sore throat. Once you have asked them all these questions, the last question is the additional notes field. Here is where you can enter anything. For example, if the person ate at a certain place, or if they noticed that there were a lot of people ill around them on their flight, or anything that might be important, you can enter this into field 11. And what is important to me right now is that this is a demonstration, this is a test, so I will just enter this as a test. The last thing that you do is submit a report. And once the report is submitted, you see this pop-up box telling you that your report has been submitted. So remember, this is the data analytics page. Sorry, this is the data entry clerks page. So if you wanted to go into data analytics, you are not able to. You see access denied. The last thing that is important is the monitoring of 0 cases. Now, this is important, especially for the Ministry of Health, because there's a difference between not reporting and having no cases. If, for example, last week you've seen no cases at your hotel and you say nothing, the Ministry of Health is not sure if you've had 0 cases or if you have just not reported. So in this case, there is this button that says 0 case. Every week, you will log in at the end of the week and click 0 cases if you've had no cases for the week. In that way, the Ministry of Health knows that you are reporting, but you've just had no cases. And that's very simple. You just click 0 cases and this pop-up box comes. 0 cases have been reported and confirmed for the current epi week. And this has to be done on a weekly basis so that whoever is monitoring the system, whether it is the hotel manager or the Ministry of Health, they know that this facility is reporting, but they've had no cases. I'm just going to sign out now to show you the data analytics page. So now I am signing in with the manager access for Phoenix Resort. Again, I have to choose facility when I'm signing in. Sorry, I had to refresh the page. And this is the data analytics page. Again, the manager is able to report a case, which is the same form as in the previous demonstration with the data entry clerk. They're able to report 0 cases, but they also have the added benefit of seeing data analytics. So this is the Phoenix Resort, and this is all the information that has been reported for the year 2018. And you can see that the weeks are numbered, week 0 to 52. And you can see all the graphs with all the same 6 syndromes that we highlighted earlier. So if you wanted to see, for example, just gastroenteritis over the year, all you do is exit out of these and you are able to see just the gastroenteritis graphs. The system generates all these graphs automatically for you once you start reporting data. If there's no data to report, there will be no graphs shown, obviously, because there's no data to generate any graphs. So you can hover over any week and the system will tell you how many cases have been reported. So for example, in week 17, for the Phoenix Resort and Country demonstration, there were 14 cases of gastroenteritis in that week. The system also generates other graphs for you. It deaggregates the data by age, by syndrome and age group, by gender, and by each of the individual syndromes, guests versus staff. And again, it's similar if you wanted to see just guests who had gastroenteritis, all you do is click away the staff and you get all the guest data. If you wanted to see the staff data, you click back the staff and you see all the staff data. If you as a manager, and I'm just going to bring back all these things. If you as a manager wanted to see a specific week, so for example, you wanted to see week 21 to 25, what you do is you choose date range selection, you choose your year, which will be 2018, you choose week 21, and you want to end at week 25, you just apply your filters, and you're able to see this 4-week period, this month. That might be important, for example, if you know that something might be going on in a particular month at the hotel and you just want to see that month, you are able to do that. And you see here, you just have gastroenteritis and respiratory, but for example, if you're only interested in the respiratory cases, you just click away the gastroenteritis and it'll be able to tell you how many cases of respiratory illness you've had at your facility over that period of time. And similarly, all the reports will be from the same time when you apply your filter. The other thing that can be done is that the charts can be exported. So you as a manager have the ability to either print a chart or download the image. For example, if you have a meeting with someone that needs to see the surveillance data for your hotel, you have the ability to print that data. So you don't necessarily have to give them access to your system. But for example, you can apply a filter, print out a chart for a particular month, and just show them that month. Or if you want to keep it for your own records, if you like to keep paper records or anything else, you can either export the chart, you can print the chart or download the image and keep it in a separate document. The other thing that can be done is the data can be exported. As a manager, you are also able to export the data. And what happens, all you do is export all data, and then the data comes up as an Excel sheet. Let me just wait for the Excel to open. We will export the data and open the Excel sheet. And this Excel sheet would be every single case that has been entered into the system. So if you want to go back and check a case, you're able to do so. So for example, if you notice that you have a cluster of cases coming up with gastroenteritis at a certain time, you can export the data. You can look at the case IDs. As the system generates the case IDs for you, once the data is entered, you can go all the way across. You can see what syndrome there is and if there are any notes. So for example, if you want to see that if all those persons ate something similar, that might be in the notes section. If you want to see the exact symptoms that the person may have exhibited, you can do that here. The age group of the persons, if it was a guest or a staff, when in the year, what epi week, what year, etc. When it was reported, obviously the country number and the country name will be the same because you will only be seeing data from your hotel, and the facility name will also be the same because you'll be only seeing data from your hotel. But all these other fields you are now able to toggle within Excel if you wanted to make your own graphs, if you wanted to manipulate the data in some way, if you wanted to make cumulative data, tally the data, whatever you want to do, you can do this in Excel, and you can share this, you can save this Excel sheet and manipulate the data in any way that you need to. So again, this is the system, and it's very intuitive. Now, to register, you will see that in the package that you received, you have had a registration form, but you can also go to the CARPHA's website and go to the Tourism and Health page. And find a registration form on that page. What we will do is at the end of this video, I will share the login details with you so you can practice using your system. You can go into the system before you register to see if it's as easy as you think. And you can always contact us, and I will share our contact information with you in case you need any further clarification. So on the CARPHA page, you go to the Tourism and Health Program page, and all the information is here. You can see the THP brochures, you can see all our PowerPoint presentations, you can also see the registration form. And this is the registration form, and all you do is fill this out and send it back to CARPHA, and we will input it in the system, and the system will then send you your registration. So I will pause here for a second. This is the demonstration account. And you can copy this down and go and try out the system yourself. Once you have completed your registration form, you can send it to this email address, carphas-tourismandhealth@carpha.org. Send the registration form, and we will input the registration into the system for you, and the system will generate your own username and password, which is completely confidential. And it will be sent directly to the hotel manager, whoever is designated on the registration form, both the data entry and the manager's email will be sent to the manager's account for registration. Once the system has sent you your username and password, you can then feel free to start reporting data. If there are any further questions, please feel free to send us an email or contact myself or Dr. Indar for any issues. And that is the training for the Tourism and Health Information System. Thank you.